Okay, let's unpack this incredible story today. How Tata Memorial Hospital in Mumbai, TMH, has built this really quite revolutionary model. It's all about making sure that money, or lack of it, doesn't stop people getting life-saving cancer treatment in India. I
Yeah.
mean, we all know, don't we, the sheer weight of a cancer diagnosis. There's the emotional side, the physical, and then often this just overwhelming financial pressure.
Absolutely. It's a huge burden.
But TMH, it stands out, you know? It's seen as this beacon of hope, specifically because it offers care that's either free or, well, heavily subsidized.
Mhm.
So our mission with this deep dive, we want to give you the inside track, sort of demystify how TMH actually pulls this
Yeah,
off.
break it down.
Exactly. Look at the actual pathways to get care, the support systems they have, and, what you really need to know if you or someone you know needs to navigate the system.
And it really is a fascinating case study when you look at healthcare access. I mean, the scale of what TMH is doing and the scope, it's just remarkable. It sets a kind of standard, really, an inspiration for healthcare systems everywhere, I'd say.
It definitely sounds groundbreaking, but what makes it so interesting, maybe even a bit counterintuitive, is that it's not just like pure charity, right? It's built on a very specific financial strategy.
That's right.
Can you break down this strategic model for us? How does the engine behind the empathy actually work?
Absolutely. So the core idea is something called a cross-subsidization model.
Cross-subsidization, okay.
Yeah. Essentially, the fees that are collected from patients who can afford to pay,
Mm.
self-paying patients or international ones, they categorize them as BF, which means private or foreign.
Hmm.
Those fees directly fund the treatment for patients who can't afford it. So the free care and the heavily subsidized care. It's like an internal ecosystem, you see.
Wow. So those who can pay are directly helping those who can't inside the same hospital system.
Exactly.
And the impact is huge, isn't it? I saw a figure for 2024-25, something like 60 crore was raised this way.
That's the figure, yeah. Around 60 core. And think about what that translates to.
It funded care for around 4,000 pediatric patients, completely free.
Completely free treatment for about 4,000 children. That's, a massive weight lifted off those families. We're talking maybe 1.5 lakh per child per year, potentially fully covered.
That's incredible. It really shows this isn't just about goodwill. It's a smart, sustainable way to fund healthcare. It kind of reimagines the whole funding picture.
It does.
But I wonder, does relying on this put, I don't know, too much pressure on the paying patients? Or maybe limit how many people can actually get the free care?
That's a really important question. And it points to the delicate balance they have to manage. Obviously, the paying patients are vital, but the system is designed to be sustainable. They work hard to optimize resources, serve as many people as possible, but without letting the quality of care slip. It shows you can actually redistribute resources effectively within one place to make healthcare more equitable.
Yeah.
And if you connect that to the bigger picture,
Mm-hmm.
it really makes you think about how we can build healthcare systems that are more equitable, more sustainable, not just in India, but globally.
Yeah.
Maybe using different funding streams more creatively.
That's a powerful thought, yeah. How this model could have ripples far beyond India. But let's bring it back down to the individual level. If you're listening and you or someone you care about needs this, how do you actually get into this system? I understand it starts with different patient categories for adults.
Exactly. For adults, TMH primarily uses 3 categories, and it's
Yep.
all based on income and affordability.
Okay.
So first, there's NC. That stands for nominal cost. This is for people with the very lowest income levels. The charges are, well, nominal, minimal.
Got it. NC nominal cost.
Then you have C, which stands for general. Here, the treatment is subsidized, and importantly, there are no professional support fees charged.
Okay. C general subsidized.
And lastly, there's the BF category. That's for private or foreign patients. These are the self-paying individuals whose fees, as we discussed, fuel that cross-subsidization.
Right, the ones enabling the NC and C care. So if you need that subsidized care, the NC or C categories, how do you qualify? There's a specific process, right?
Yes, there is. It involves a key step called a means test.
The means test.
Yeah. You have to undergo this assessment at TMH's Medical Social Work Department, the MSW department. That's where they evaluate your financial situation.
Okay, the MSW department. And what do you need for that? What kind of documents are we talking about?
Right. You need to be prepared. They require several crucial documents for this means test. You'll definitely need your ration card,
Okay.
an income certificate, your Aadhar card, or some other official photo ID proof. You also need your TMH Smart Card, which you get when you register, and the hospital registration page itself.
So Ration card, income certificate, ID, TMH card, registration page. Quite a list.
It is, but each one helps paint that financial picture accurately. The ration card helps verify the household's economic status. The income certificate is obviously key. It's not just red tape, it's about getting you into the right category for support.
Makes sense. And beyond this internal funding model, TMH also connects patients with government help, doesn't it? Adding another layer of potential support.
Oh, absolutely. This is where you see how well integrated the system is.
Yeah.
TMH actively participates in major government health insurance schemes.
Which ones should people know about?
Well, two big ones. First, there's the Mahatma, Jyotiba, Phule, Arogya, Yojana. Used to be called RGJAY.
Right, MJPJY.
Yeah. This is specifically for people holding a yellow or orange ration card issued in Maharashtra. It can cover up to 1.5 lakh rupees per year for a lot of different cancer treatments.
Okay, that's significant for Maharashtra residents.
Definitely. And then there's Ayushman Bharat. That's the big national health protection scheme. For eligible patients, Ayushman Bharat can potentially cover the entire cost of treatment.
Wow, full coverage.
Yeah. So having these government schemes layered onto their own system means there are multiple safety nets, multiple avenues for financial support, catching people from different economic backgrounds.
That multi-layered approach seems really key. Now, something that really stood out for me was the approach for children. It seems quite different.
It is, and it's incredibly heartening.
You mentioned earlier that thousands of kids get free treatment. Is it automatic for them?
Yes, that's the crucial difference. Pediatric cancer patients, generally those under 14, are automatically eligible for completely free treatment at TMH.
No means test.
No means test for their medical care. The hospital's philosophy is basically that a child's treatment shouldn't wait or be compromised because of finances. The focus is just getting them the care they need right away.
That's genuinely amazing. Such a clear commitment.
It really is. And that commitment extends beyond just the medical side. They understand the wider challenges families face.
Like accommodation, travel, that must be a huge issue.
Exactly. So right now, there's a new facility being built, a 226-bed free accommodation center at AC Trex, which is TMH's research center in Kargar.
Free accommodation.
Yes, specifically to support these young patients and their families during treatment. And this is being done in partnership with fantastic NGOs like St. Jude India Child Care Centers.
St. Jude, yeah, I've heard of their work.
They do incredible work providing safe, free housing. It just shows this holistic view, doesn't it?
Right.
It's not just about the chemo or the surgery. It's about supporting the whole family through an incredibly tough journey, recognizing that things like a place to stay are also major stressors.
That holistic support angle is so important. It really goes beyond just the medical treatment itself. So you have the hospital system, the government schemes, and then this whole network of support. How do patients actually, navigate all of this once they arrive at TMH? Who helps them piece it all together?
That really brings us back to the Medical Social Work Department, the MSW. They are absolutely vital. They're usually the first point of contact for anything related to financial assessment.
So they do the means test, figure out the category.
Exactly. They categorize you NC, C, or BF, and then they guide you through all the subsidy processes, which can feel pretty complex, honestly.
I can imagine.
But the support system doesn't end with the MSW department. There's also this amazing network of non-governmental organizations, NGOs, that provide critical external help.
Ah, the NGOs. They sound like unsung heroes in this story. What sort of things do they actually do for patients?
They are absolutely essential partners. I mean, think about an organization like the Cuddles Foundation.
Okay.
They focus specifically on nutrition for young cancer patients, which is often overlooked but so important for treatment outcomes, making sure kids have the nutritional support to fight the disease.
That's a great example. Very specific need.
Right. Or St. Jude, as we mentioned, building free accommodation. They recognize that the financial strain isn't just the hospital bill, it's finding somewhere safe and affordable to stay, sometimes for months.
Yeah, that makes total sense.
And there are others too, like CanCare, the Nargis Dutt Foundation, the Indian Cancer Society. These groups offer a whole range of support. It could be direct financial aid for things treatment doesn't cover, help with transport costs, assistance finding accommodation. They really fill the gaps and make sure patients can actually complete their treatment journey.
It really underscores how healthcare needs this collaborative ecosystem, doesn't it? Hospital, government, NGOs, all working together.
Couldn't agree more. It's that synergy that makes the TMH model so effective.
Okay, so let's synthesize all this. For someone listening, maybe feeling overwhelmed but hopeful, if they or someone they know needs care at TMH, What's the practical step-by-step guide? What should they actually do?
Okay, let's break it down clearly. Step 1. You need to register at TMH Peril. That's a main hospital location. And crucially, when you go, make sure you have your ID proofs, and if possible, your ration card and any income certificates handy. Bring them with you from the start.
Got it. Register at peril, bring your documents. What's immediately next? Like right after registration?
Your very next stop, ideally, should be the MSW department or the Financial Assistance Office. Don't put this off. Go there as soon as you can after registering. This is where you officially request that means test we talked about.
Okay, MSW office, request the means test. And that's where you'll need.
That's where you need to provide all those required documents we listed earlier, ration card, income proof, ID, etc., specifically for getting assessed for the NC or C category. Being prepared here really helps.
Right. And what about those government schemes?
Good point. If you think you might be eligible, say you have the right ration card for MJPJAY, or you might qualify for Ayushman Bharat, you should definitely apply under those government schemes.
Should you ask the MSW department about that?
Yes, absolutely. Ask them for guidance on applying. These schemes can cover a huge chunk of the cost, sometimes everything, so it's really worth pursuing if you qualify.
Okay. What if the medical bills are covered, or mostly covered, but there are other costs piling up, like getting there, staying nearby?
That's exactly where the NGOs come in. So step 5 is to contact the relevant NGOs. If you need extra help with transport, accommodation, maybe even just daily living costs during treatment, these organizations are there to assist. Don't be afraid to ask for help.
Good advice. And finally, a special note for families with children.
Yes. For pediatric patients, specifically request the Pediatric Oncology Division. And make sure to ask about those free shelter options we mentioned, like the one supported by St. Jude. This ensures your child gets that immediate barrier-free care and you get support finding accommodation.
That seems like a clear pathway, but it sounds like you need to be quite proactive, right? It's not just passive.
Absolutely. Being proactive is key, and maybe a few practical tips can help make it smoother.
Yeah, definitely. What should people keep in mind?
Okay, first, always carry your original documents. We keep saying it, but it's crucial. Aadhar, ration card, income certificate, have the originals ready for any assessment or application.
Right, originals are key.
Second, once your means test is done, ask for your file category. Know if you've been classified as NC or C. It helps you understand the charges.
Okay, know your category.
Third, follow up. If you've applied for a government scheme or other financial support, check on the status. Sometimes a little persistence is needed.
Don't just wait passively.
Exactly. And finally, actively seek help from NGOs and guest accommodations for things like lodging and travel. They expect people to need help. That's why they exist. Reach out. It can ease a huge amount of stress during a really tough time.
That's all really solid practical advice. So thinking about everything we've discussed, what does this all mean for you, the listener? Knowing that this kind of comprehensive system actually exists, designed specifically to lighten that financial load of cancer treatment. I think it just highlights how powerful being informed is, whether it's for yourself or for someone you love, or even just understanding how vital services like this can be made accessible, on a large scale. It shows it's possible.
It really does. And it prompts a bigger question, doesn't it? In a world that's constantly struggling with healthcare access and costs, what wider lessons can we learn from TMH's approach? This unique blend of cross-subsidization, government partnership, NGO collaboration.
Yeah, what can other places learn?
Exactly. How might this specific successful model inspire new solutions, maybe new innovations in other healthcare settings? Could it challenge some of those old assumptions about who pays for care and how we can actually work towards making life-saving treatment a fundamental right, not just a privilege for those who can afford it?